Did you know that according to the WHO, 1 in 3 adults suffer from high blood pressure? Yes, and out of these, just 1 in 3 have their blood pressures under control. In today's video, we will be exploring some medications used in the treatment of high blood pressure, and we'll be focusing on antihypertensives. You want to stay along even as we dive into this video. Thank you to all my returning subscribers. We really appreciate it that you still stay with us. And to our new subscribers, we are happy you have joined the channel, because on this channel, we bring you information regarding the Nclex RN exams, tips and tricks you need to know, and understanding the concepts there are. So in today's video, we'll be looking at antihypertensives. Now, these are very important medications. In our previous lecture, we did talk about what hypertension is and everything we need to know. If you haven't watched that video, I would encourage you to go back and watch that video and then come back and then look at the antihypertensives. So what are antihypertensives? So antihypertensives are basically drugs that help us to reduce blood pressure. They are also used in managing chronic hypertension, and what this medication does is that it reduces the workload of the heart. In order for us to remember the drugs that are used in the treatment of hypertension, we mentioned in the previous video that we need to look at it as A, B, C, Ds. So we have your ACE inhibitors, your ARBs, we've got beta blockers, we've got calcium channel blockers, we also have digoxin and diuretics. So these are the main medications that are used in the treatment of hypertension. We have done separate videos on diuretics and digoxin. So if you haven't seen that, I would encourage you to go back and then have a look at these videos that we have already done. In today's video, we'll be looking at the ABCs of managing hypertension. And the very first one we'll look at is your ACE inhibitors. ACE inhibitors is basically what we call angiotensin converting enzyme inhibitors. So your ACE inhibitors basically will prevent the conversion of angiotensin 1 to angiotensin 2. Now, angiotensin 2 is a potent vasoconstrictor. So once your vessels are constricted, it in turn increases your blood pressure. So what this medication or this group of medications does is that they prevent conversion of angiotensin 1 to angiotensin 2. The group of medications does is that they prevent the conversion of angiotensin 1 to angiotensin 2, which is a potent vasoconstrictor. So by virtue of these not being available in the system, your vessels are dilated and your blood pressure is reduced. Also, angiotensin 2 prevents the secretion of aldosterone, and aldosterone is an enzyme that causes the retention of sodium and water. And we know that with increased sodium and water, your blood pressure increases. What are the medication names of these class of antihypertensives? So in order to help us remember these, we should know that all ACE inhibitors have the suffix ending in pril. So examples of medications in this category will be lisinopril, ramipril, enalapril, and captopril. There are many other ones, but once you see the pril, it tells you that this belongs to the class of ACE inhibitors. With every medication, there are side effects. So we want to look at the side effects of ACE inhibitors. Usually you have angioedema, you've got a cough, and then you've got an elevated calcium. Now, it is important to mention that a persistent dry cough is common in persons taking ACE inhibitors. And so you don't need to panic or worry when you have dry cough. Usually it should subside within weeks of starting the medication. However, if this persists, then you would want to report this to your primary healthcare provider. With angioedema and elevated potassium levels, this is something you would want to treat because this is a medical emergency. So with angioedema affecting the face, usually you risk losing your airway, and with an elevated potassium, you are at risk of cardiac dysrhythmias. The next class of drugs we want to look at are your ARBs, so your angiotensin II receptor blockers. So with this medication group, in order for us to identify them, they have got a suffix of Satan. So every medication that ends in Satan, it gives you a clue that this is probably an angiotensin II receptor blocker. Now, examples of such medications are candesartan, losartan, valsartan, and your irbesartan. Just like your ACE inhibitors, angioedema and the cough are side effects of ARBs. And we are saying that for persons who cannot use ACE inhibitors, ARBs are a very good alternative to be given to these people. Now, moving on to the B in our mnemonic ABCDs, B stands for beta blockers. What your beta blockers do is that they block your beta 1 receptors, and beta 1 is needed for the function of your sympathetic nervous system. Now, we know that the sympathetic nervous system is involved in your fight or flight responses. And usually, when you have fight or flight responses, you have your blood vessels constricting even more, which then increases your heart rate, increases your blood pressure, and increases your heart rate. So beta blockers helps to block these receptors in order to prevent fight or flight, to in turn reduce your blood pressure. So how beta blockers work is that they work by decreasing your heart rate, reducing your blood pressure, and also reducing your cardiac workload. Now the medications in this group have also got a suffix of olol. So OLOL. So any medication that ends in OLOL is a beta blocker. Examples of these medications are labetalol, propranolol, and atenolol. Let's look at the side effects of beta blockers. So beta blockers can cause you to become bradycardic and can also lead to some level of heart blocks in some patients. It also causes bronchospasm, and so in persons that are at risk of bronchospasm, you want to avoid beta blockers in this group of patients. It also can lead to hypotension. Now we know that we are using beta blockers to try and reduce your blood pressure, but if we overdo it, it can also lead to a low blood pressure. And it also does this we call blood sugar masking. So when you take beta blockers, it can mask any hyperglycemia that you may be experiencing. Beta blockers are contraindicated in a certain group of patients. So patients with asthma, patients who are already bradycardic, patients with heart failure and severe renal disease. You want to avoid beta blockers in this group of patients because of the side effects we just talked about. Let's move on to calcium channel blockers, the C's in your ABCDs for antihypertensive. Now, how this works is that it works by reducing or decreasing your cardiac contractility. And so this decreases your cardiac workload, which results in what? A decreased cardiac oxygen demand. It also promotes vasodilation. And we know that in order to reduce blood pressure, we want our vessels to be as dilated as they can in order to allow for blood to flow against a reduced pressure. For calcium channel blockers, it has also got a suffix of dipane, so DIPINE. So examples will be nifedipine, amlodipine, nimodipine. However, there are some other names of medications that belong to the same class as calcium channel blockers, but do not necessarily have the suffix dipine. An example will be diltiazem and verapamil. These are also calcium channel blockers, but do not have the suffix dipine. Having talked about the different group and the different class of antihypertensives, we want to look at the nursing considerations for patients who are receiving antihypertensives. The first thing you want to monitor is for any signs of hypotension. Now, when you give a medication to lower the blood pressure, there is a tendency to get your patient into a hypotensive state. And so you want to monitor for hypotension. And the other thing you want to look out for will be orthostatic hypotension. That is a drastic change in your blood pressure when you change positions. And so you want to be educating your patients to not change positions very rapidly, but rather should do it slowly and steadily. You also want to monitor your electrolyte levels, and we are looking specifically at sodium and potassium. And the reason why we are looking at these two electrolytes in particular is the fact that sodium leads the retention of water. And when you have increased water in your intravascular space, you tend to risk your blood pressure being increased. And with potassium, you are at risk of cardiac arrhythmia. So with a heart that is already struggling to pump under high pressures, when you have increased potassium, there's an increased risk for cardiac arrhythmias. So you want to be looking out for signs like muscle cramps, tachycardia, dizziness, and weakness. When you experience these, you want to investigate further and address them appropriately. One of the other signs you want to look out for will be angioedema, especially facial swelling, because when there is the presence of facial swelling after taking an antihypertensive, that is a medical emergency, and we need to report that immediately. Also, you want to educate your patients on the need for the adherence to treatment regimens and plans. This is to avoid what we call rebound hypertension. And we'll be all for this Nclex review on antihypertensives. We say that to manage hypertension, we need to think of our ABCDs, and these helps us to know the class of medications that are used in the treatment of hypertension. So we've got your ACE inhibitors, we've got your ARBs, we've got your beta blockers, your calcium channel blockers, we've got digoxin and diuretics. But in this video, we talked about the ABCs of anti-hypertension, or the ABCs of hypertension management. Hope you found value in this video. If you haven't done so yet, I want to encourage you to like the video, leave a comment, and subscribe to the channel so that when we post a video, you'll be one of the first people to have access to it. I hope this video gave you value for your time on the channel. Thank you for watching, and we'll see you on the next one.